Here at ESC Congress, I just presented the meta-analysis summarizing the totality of evidence supporting the use of SGLT2 inhibitors in patients with heart failure. We began with the area of greatest uncertainty, those individuals with heart failure with mildly reduced or preserved ejection fraction, encompassed in two large-scale trials, DELIVER and EMPEROR Preserved, and totaling 12,251 participants. Overall, when pooling these trials, we found that the SGLT2 inhibitors dapagliflozin and empagliflozin significantly and robustly reduced the primary endpoint of cardiovascular death or heart failure hospitalization by 20%. And we saw substantial and important reductions in both of the components of that primary composite endpoint. Then we took a step back and examined the totality of evidence across 5 large-scale trials, including populations of reduced ejection fraction and worsening heart failure. This meta-analysis that was more comprehensive analyzed over 20,000 participants and found a 23% reduction in cardiovascular death or heart failure hospitalization, a 28% reduction in heart failure hospitalization alone, a 13% reduction in cardiovascular death, and an 8% reduction in all-cause mortality. Most importantly, we saw no evidence of heterogeneity across all analyzed subgroups and within any of the individual trial populations. So this totality of evidence now supports the strategy of using an SGLT2 inhibitor for all patients with heart failure, barring any contraindications, and irrespective of ejection fraction, specific patient phenotype, or care setting.